Are we good? Here we go.
The Seattle King County Clinic is coming soon, and thousands of people are expected to take part.
Dental, very expensive.
For the medical.
Many need medical care, but dental and vision are also covered, and all services are free.
So here's one.
You can have a job, you can have insurance, you can have neither of those things. And when you're in here, everybody treats you like you're a person.
Volunteers? Yeah. Volunteers, super.
None of this would be possible without an army of volunteers. It's not too late to sign up.
Without volunteers, we couldn't operate.
These stories and more next on CityStream. Hi, I'm Tatevik Aprikyan. Welcome to a special edition of CityStream. Soon, thousands of people will converge on Seattle Center to get free medical, dental, and vision care. It's all a part of Seattle King County Clinic, a 4-day event that runs from February 15th to the 18th. This entire episode of CityStream will explore different aspects of this clinic. Services include dental fillings and extractions, eye exams and prescription glasses, also mammograms, x-rays, immunizations, ultrasounds, and much more. Some of it will happen here at McCaw Hall, and all services are free. Plus, the clinic is open to everyone, regardless of insurance, income, or immigration status. Producer Randy Eng has a preview.
It is 4:25 a.m.
Greetings. Welcome.
Thank you.
We're glad you're here.
Okay, we're about to start handing out tickets, so please get in your seats.
Dental, very expensive. I did it last year. I didn't finish everything, so it's free here.
For the medical.
Free dental is my number one reason. Even if with insurance, dental is very expensive. And I have a tooth that might need to be pulled or extracted, and so this will get it taken care of.
Even though I need vision, I'm just going to wait to see how much it is with my Medicare.
Good morning. We have a 5 a.m. check-in time for the first shifts of volunteers that include both general support and a lot of nurses. And it's really about getting the first part of the process staffed. So down there, patient intake nurses will start getting trained. Up here at patient registration, they'll start training them on the patient registration system.
Once you turn on your computer, this is what you'll see.
The interpreters will be here, and they'll start getting trained on their process to prepare for us to open doors at 6:30.
Ladies and gentlemen, we are about to open the doors. Are we good? Here we go.
¿Cuántos años ha sido desde que ha visto un dentista?
3, 4.
We've handed out 432 of the 550 dental tickets that we have allocated for today. We've handed out 233 of the 300 vision tickets we've allocated for today, and 43 of the medical-only tickets. So we're in good shape. It's 7:09 a.m., so 30 minutes after having started admitting people.
Everything is here, and it's for anybody. You can have a job, you can have insurance, you can have neither of those things. And when you're in here, everybody treats you like you're a person.
Welcome. We're glad you're here.
This clinic is unique from a national standpoint, both in its scale and accessibility. This is what it looked like in 2014, the first year of this massive community effort. And in the 10 years since, the clinic has saved 27,000 patients more than $23 million in out-of-pocket costs that would have been unaffordable to them. That's a lot of people taking advantage of this free clinic, and it might surprise you to see who's coming here for help. In 2023, patients shared that 96% of them were housed, 34% were unemployed. 60% said their number one reason for attending was because they could not afford healthcare costs. And 22% actually had insurance but still could not access the type of care they needed. One example, those in desperate need of dental care. It is the most requested service at the Seattle King County Clinic. And people are willing to wait hours and hours to get help. A lot of them are considered the missing middle. Those are people who are increasingly left out of our healthcare systems and safety nets. Project executive and clinic founder Julia Colson says these people make too much to qualify for assistance, but not enough to afford the care they need. So they come here looking for help at the clinic.
I am self-employed. I have health insurance, but it's sort of the minimum mandated health insurance, and there's no dental on it.
Some of the dental services provided at the clinic include cleanings, fillings, root canals, and extractions. All of it free to the patient. Same as dental, many insured people cannot afford vision care, but this clinic can help. Plus, tracking the staggering number of supplies is a full-time job. These stories next on CityStream.
It's no one's fault. It's the system's failure. And these folks just happen to be in the middle of that at that moment, which really any of us could be in at any time.
Welcome back to this special edition of CityStream from McCaw Hall. Vision care is another important service provided at the Seattle King County Clinic. And for hundreds of people in need of prescription glasses, each one of them will get a custom pair of new glasses. Producer Randy Ang and project executive Julia Colson take you through the process.
Just let me know which one looks better. So here's one, here's two.
Think about the impact the ability to see has on your life.
3, 4.
Having a pair of glasses that fit you appropriately, that help to improve your vision, and that are a style that you feel confident in, helps you to present yourself and navigate the world with a whole lot more confidence.
That's a little better.
This might be the only pair of glasses that a patient gets for several years. And so we want to make sure that it's going to last. When we have the mobile labs, they have limitations as to how many lenses they can carry. And we don't know what needs we're going to have. And so in order to anticipate every particular patient's needs, you need thousands and thousands of pairs of blank lenses.
These are custom to them. It's their selection of what they like or the colors they like. And it's a prescription that, it wasn't somebody's old prescription that we're trying to approximate to them. This is absolutely what they need.
The patients will come in. After their exam, they come down into our area of optical. They'll sit down with an optician, discuss their prescription and their visual needs. The optician will help them select the appropriate frame for their prescription and their face and their style. And then we'll write up the order. It goes to another person who double checks that everything is correct.
So I can skip it out if we don't have it. Okay. I am very, very picky and passionate about people getting the right eyeglasses when they return to pick them up. We have 3 different sets of eyeballs. Look at them. We make sure that the names match and the frames match what the patient is expecting to get when they return. And then we log on the computer and we place the order and transcribe exactly what the doctor has written for their prescription. The people don't get the glasses unless we're back here doing this, so we can have all the medical people in the world come and volunteer, but they would have to take time out from actually seeing patients to come back in here and do this. So if we can cover that part, then that frees up so many more hours for patient contact.
And then from there, we will take the frame, the actual frame the person tried on, wrap it up in an order form, and send it off to our optical lab.
We've been involved with the Seattle King County Clinic probably since it started. We've been doing the glasses for them, and it's been rather enjoyable. It's nice to give back to the community. The masses goes to Texas. They crank all the bread and butter stuff out, and then we get to do all the hard stuff for the customized product, where the prescriptions that people have problems with, the prisms, all the fun stuff. It's really important for them to get good vision. So when they put our product on, their lives improve. It's a product that can change lives for people, and that kind of drives us each day. You've got to help other people, and that just makes you a better person, and it makes us a better company.
About 5 weeks ago, we held the clinic, and about 1,000 patients had prescription eyeglasses ordered. And they have since come back, and so the patients, over a period of 2 days, have an opportunity to come pick up their glasses and then meet with opticians again to have them fitted to make sure that the prescription was done correctly, because if not, we can send them back to the lab and have them fixed. And then we will be mailing out eyeglasses for anybody who didn't come retrieve them today. This is the end of kind of the patient deliverable piece, but then after that, I'll be working on the final report to essentially kind of wrap up. And based on our experiences, our minds are already churning with how to make improvements going forward.
Seeing the world with clarity is a great comfort to anyone. Clarity is also key to understanding the health needs of people who don't speak English. Last year, patients at the clinic used 51 different languages. The clinic has many interpreters, some who recorded informational greetings that put patients at ease from the start.
Ready?
Okay, you're ready.
你好.
Hello.
Y bienvenidos a la Phone Cam Seattle King County Clinic.
Today we have had 4 folks to do recordings in the top 4 languages: English, Spanish, Vietnamese, and actually we do Cantonese and Mandarin, so I guess that would be 5.
欢迎光临西雅图新郡诊所.
This is the very first part where we can kind of put them at ease and give them some general instruction and direction of what to expect.
Bắt đầu từ 5 giờ 30.
It's not always easy for people to approach you with a question or to ask what they need to ask.
Please be back by 5:30 a.m. when we distribute tickets.
请尊重您的邻居，有些人在试图休息。
This is one of those small details. It really helps patients feel comfortable, to feel a little more at ease in their surroundings.
Cuando esté dentro del Fisher Pavilion y otras instalaciones de la clínica.
No, I'm not a pro, but really I do enjoy doing it, and really I just want to use my skills, my time, my hours, everything that I can just to help this to be possible.
Aquí en el Fisher Pavilion.
Please remember to wear your mask.
Yêu cầu quý vị đeo khẩu trang trừ khi ăn uống hoặc đang được điều trị. 请随时与工作人员交谈.
It is awesome listening to the languages, and we appreciate it so much.
Okay, thank you.
Interpretation technology is on a roll at the Seattle King County Clinic. At times, interpreters are tied up helping someone when they're also needed elsewhere. The clinic reports 57% of its patients speak languages other than English. But these rolling video screens can put patients face to face with someone who can interpret.
We work with a partner called AMN Healthcare. They have remote medically certified interpretation that's available to us. So while we have on-site interpreters, a lot of them are not medically certified. We can't anticipate what languages patients are going to be speaking when they walk in the door.
The interpreting machines are invaluable, and without the interpreters and the interpreting machines, we wouldn't be able to provide them with the kind of care that we are aspiring to provide them with. And then they're able to really communicate their needs to us, and we're able to meet their needs.
Meeting the needs of thousands of patients requires a huge cache of medical, dental, and vision supplies. Gathering, purchasing, doing inventory, and finally distributing these items for use is a year-round job. Project executive Julia Colson explains.
Supply management is a year-round process. It kind of starts when the clinic ends. In the weeks afterward, we inventory and organize the supplies to figure out what remains.
Welcome to the Seattle King County Clinic Supply Room.
Then we start planning the next clinic. Based on our previous usage number and existing inventory, we then create our order lists, which itemize tens of thousands of supplies that we need. All of the supplies that we get are new supplies and they are within the expiration date. We take it very seriously that we are a healthcare facility, and so we want to make sure all of the items are the same types of items you would experience if you were to go to a different healthcare facility in the community. And about 5 to 6 weeks before the clinic, we have the supplies delivered and we hold a week-long supply sorting event.
6 cans I'm taking.
There's tens of thousands of items that we're having to track and count and organize and sort, and some of them are teeny tiny, you know, the size of a finishing nail.
The dental burrs are like little Dremel drill bits. They're tiny, they're different sizes, different shapes. We have tens of thousands of burrs that we have to count each year.
About 3 days before the clinic opens, dozens of pallets are moved from storage into the clinic facilities, and we also take delivery of equipment, instruments, and even more supplies. Then volunteers help to unpack and distribute and lay out and set up all of these items. Once the clinic opens, we have leads who track and manage the supplies on site, resupplying areas, or placing additional orders if needed. And then when the clinic is done, we have 1 day to pack everything up. And we've got to return loaned and rented items to the rightful owners and get out of the facilities. And then after loadout, the supply management cycle repeats. I mean, if people really sat down and thought about it and really took a look around and went, oh, there's a lot of stuff that's in this clinic. I wonder how that all got here. Then they may kind of start to realize there's a lot of stuff. But if we've done our job well, they have what they need to care for the patients in front of them.
Next on CityStream, this critical service helps doctors make the correct diagnosis. And without thousands of volunteers, this clinic would not be possible.
The majority of the people come do have some form of health care, but they can't afford to use it because the copay is too large. The out-of-pocket is unavailable. You walk in the door and you're experiencing pain and infection and it's affecting your whole life, and we can fix that for you today.
There might be some problems with the system, but at least here there's not a problem with the people. The people all want to help. So I think that says a lot about our community.
These doctors spend all the time in the world because they're not doing it for money, they're doing it from their heart.
It's amazing. It's just so much love. You know, you feel like family right here.
Welcome back to this special edition of CityStream focused entirely on the upcoming Seattle King County Clinic. This incredible public service provides medical, dental, and vision care to all residents at no cost. The dates for the clinic are February 15th to the 18th at Seattle Center. For more information, go to this website, seattlecenter.org/SKC Clinic. One service offered at the clinic gets little attention, but it's critically important. For patients potentially battling serious disease, lab tests are key to helping doctors determine the best treatment options.
It's the magic of medicine that happens behind the scenes. 70% of all diagnosis and treatment is based off of laboratory results. After the patients are seen, normally the physicians will request for laboratory tests to be done. And from there, we know exactly what to collect. And so venipuncture and phlebotomy is performed. We then take those samples, centrifuge them all down, and send them to the regional laboratory for Kaiser Permanente for us to be able to do those tests. It's incredibly complex, a lot of instrumentation, a lot of automation, a lot of personnel who have spent years studying laboratory science and medicine. Yeah, it's a very dedicated and complex field. So laboratory analyzes, gets those results out, makes sure they're accurate and precise. We get that back to the physicians, and the physicians can see those results and interpret it as a diagnosis.
All right, Rick, I need your help with this one. Looks like he has a history of chronic bronchiectasis.
2 weeks out from the clinic, all our labs are processed, and they flag results for us which are abnormal.
They should see a doctor, yeah.
And then we need to get those results to patients and make decisions about how quickly these laboratory tests need to be followed up on. I'd probably say immediate.
Hepatitis B antibody titer, less than 8.
That means it's negative. It's flagged, but it's fine. So far this year, knock on wood, we have not found anything that is immediately life-threatening.
A little bit of cholesterol and a little bit of Billy.
Boy, that's really a little bit.
Yesterday, we worked with one of our medical directors and 2 of our clinical leads to do the sorting part of the process. Today, we are doing the mailing part of the process, and eventually by the end of the day, we'll have all of our labs out in the world. Obviously, labs come back and you get this complicated sheet of paper that has these flags on it that says abnormal or high or low, but you don't really get the context to understand what that means for you, if you should go get seen tomorrow or if you can wait, or if it might be slightly out of the normal range, but you really don't need follow-up. So that customization and that personalized plan for you is really important. It's part of our little effort to do as much follow-up and connecting patients with resources outside of our 4-day clinic.
The commitment to the cause and the end result of patient care is definitely shared. It doesn't matter what field you choose here in healthcare, the mission is the same.
An army of volunteers makes this special clinic run, but none of the complex systems and connections would function without the specialized help of Seattle IT.
Frame should have 1, vision checkout should have 2. My name is Stephen Burke of Seattle IT. The clinic directors and everything, they know exactly how critical IT is to the clinic.
Seattle King County Clinic could honestly not operate without Seattle IT. We have so many different systems across the entire clinic that deal from everything from patient registration and records to X-ray and ultrasound and EKG, all needing to talk to each other. And none of these systems have ever worked together before. We bring them on site in 1 day, and within a matter of 3 days, we have to be a completely functional healthcare facility.
It's also used internally in the clinic to track patient flow, keep track of number of patients per day, and make sure people get through the steps in the clinic too correctly.
We have these roving devices that have medically certified interpretation. That's also part of our IT setup because it's got to connect. And we can call up hundreds of different languages if we need them in the clinic.
The mission of this event has been one that shows the power of teamwork. We want to show that we're vested in the community, that this community is important to us, and that we not only serve them through the services that we provide, but also that we participate. And you see your place of work in a different light.
I've been doing this for 30 plus years. I tell people this is the most important part of my job, the clinic, and it's the most enjoyable too. So I normally do desktop support, but clinic, that's the part that I enjoy and feel most satisfied with. If I do my job correctly, they don't think about IT at all. It's very fulfilling.
The Seattle King County Clinic is a tremendous undertaking that brings together hundreds of businesses and organizations and thousands of volunteers, including retired nurse Frankie Manning, who knows just how essential this service is.
I feel so grateful because I know these people needs this care and they can't get it no place else. So I feel like this is important work.
Important work indeed. This clinic speaks volumes about the character of this community and its willingness to help neighbors in need. Producer Randy Yang has more.
We are so lucky because we have such a dedicated group of volunteers who come in.
We only have 4 staff members who work year-round on the clinic, and so with an operation of this magnitude, without volunteers, we couldn't operate. About a dozen people volunteer with us year-round.
Scrub brushes, long handle.
Volunteers also staff supply sorting or to dispense all of the eyeglasses.
And welcome to Seattle King County Clinic.
And then, of course, we've got Clinic Week.
Yeah, I'm checking in for the first day.
For the first day, in line right there, you'll get your badge and you'll get your meal voucher.
Volunteers?
Yep. Volunteers, super.
11 is open, so you can go to this.
Thank you.
So during that week, we have as many volunteers as we have patients. Over the course of the clinic, that amounts to sometimes 3,000-4,000 volunteers.
Perfect, thank you.
Volunteers come from a wide variety of backgrounds.
I'm an X-ray tech by training.
I am a retired clinical professor of medicine.
I'm an accountant for Boeing.
I have no medical dental skills at all. I mean, I have my basic first aid card, my CPR card, but that's about it.
I don't know anything medical. I do not have a healthcare background, but everybody's got something they can contribute.
I call myself basically the official problem solver.
We are accounting for the patient's information. It has to be accurate, it has to be precise.
I hope to bring my voice, not only my Spanish-speaking voice, but also my cultural competence when I help Spanish-speaking families.
We've had CEOs, elected officials, and celebrities. You never know who you're going to be working with.
I volunteered, and I always was in the intake because I always wanted to be able to look people in the eye and tell them that they not only deserve this, but we were grateful to give it to them.
It was nothing short of wonderful to see a lot of familiar faces, a lot of new faces coming together to do exactly what this clinic is for. There was feedback and stories about their experience here, some for the first time, some this is their 8th year coming back.
In our first year of the clinic, Bertha volunteered with us and she wanted to stay past the closure time. Well, in the middle of the night, there was a huge windstorm. It knocked out all the power and Bertha had still been working. And so when the emergency generators came on, I got a call from the facility people saying, Bertha's here and she wants the passcode to get back into the computers to continue her work. The next year, she said, what area is the most important to you? And that's where I want to be.
We had a patient come up and he had almost every tooth pulled that year. And he came up to us. You know, he came up to every person that had on a volunteer shirt and couldn't thank us enough. You know, he had been in such pain for so long. And even though he didn't have a tooth left in his mouth, he was grateful. I mean, that's the paycheck right there. That is the paycheck, is when you see that you've made just a huge effect on people's lives.
There are definitely people in our community who are drawn to volunteer work. They want to know that they are giving back, that they're supporting people in need, that they're supporting something that's going to uplift the community in general.
Why do I do this? You know, I hope for the day, somehow, somewhere, that we don't need free clinics, right? That's my hope. But until then, we need to care for people, and this is a way to give back.
That wraps up this special edition of CityStream from McCaw Hall. The Seattle King County Clinic begins its 4-day run on February 15th. All medical, dental, and vision services are free. If you'd like more information about the clinic, either to take advantage of the health services or to volunteer, check out this website, seattlecenter.org/SKC Clinic. I'm Tatevik Aprikyan. Thank you for watching.
2024 is time to get up.